Amazing. Dr. Max says this is for real. A breakthrough in the treatment of hair loss announced today.
An FDA-approved drug has succeeded in growing hair in nearly totally bald volunteers. CBS 2's Dr. Max Gomez says you have to see it to believe it, and he has the pictures. Dr. Max.
Yeah, exactly. Now, alopecia, it's a fancy name for a devastating type of hair loss. It starts in clumps on the head and can eventually lead to complete hair loss all over the body, even eyebrows and eyelashes. Now, researchers have found a drug that regrows hair in alopecia and may work against male pattern baldness, too. Men often equate a good head of hair with virility, and hair has been called a woman's crowning glory. So you can imagine what Sabra Hardy felt like when she started losing her hair.
I cried every night over it. I didn't feel like a woman.
It's called alopecia areata, an autoimmune disease where the body attacks the hair follicles and hair falls out in clumps and patches. It affects up to 7 million Americans.
It's a lot of people, all ages, so it can start from childhood up to adults, and it's males, females, all genders, all races equally.
Existing treatments for alopecia have not been very effective, but now researchers at Columbia University Medical Center and Stanford University have worked out the key factors that lead to hair loss. It's a type of white blood cell called a T cell that attacks the hair follicle. But the follicles don't die off, which means they might be revivable. Dr. Cristiano and colleagues found that a drug called ruxolitinib, used for bone marrow and blood disorders, actually stops the attack on hair follicles.
Unexpectedly, not only do they act on the immune cells, but they also have a beneficial effect on the hair follicle.
The study on 12 volunteers in the Journal of Clinical Investigation showed stunning results. 75% of the patients had essentially full hair regrowth. By the end of the treatment, average hair regrowth was 92%.
This shows that if you can dampen down that immune response and reactivate the hair cycle, that even patients with years, decades of disease can have a clinical response and grow their hair.
The drug is a once-a-day pill that can lead to low blood counts, although in the study there were no serious adverse effects. Now, the drug is not approved for hair loss yet, but it can be used off-label for alopecia. But it is expensive, up to $10,000 a month, and hair starts to go away when you stop the drug. Researchers are also testing it on male pattern hair loss, where early results suggest it might work on that too. And Dr. Cristiano researches this partly because she herself suffers from alopecia.
Wow.
So she's obviously very interested in
Huge news here. Doctor, thank you.
Big deal.
The cost, though, that's going to be a factor for a lot of patients.
Well, that'll come down eventually, too.
All right. Dr. Max, thank you.
You bet.